And we begin with the DRC, where more than 500 people have died so far in a cholera epidemic that is sweeping the country. The World Health Organization, WHO, said this over the weekend, raising the alarm over the epidemic, which has already hit at least 10 urban areas, including the capital, Kinshasa. It warns that the risk of spreading is still very high towards the Greater Kasai region, where degraded health and safety conditions further increase the vulnerability to this epidemic. Outbreaks of the waterborne disease occur regularly in Congo, mainly due to poor sanitation and a lack of access to clean drinking water. According to the UN, cholera has become a major public health problem in the DRC, with thousands of cases recorded every year in many provinces in the vast country. In 2016, the WHO recorded 817 cholera-related deaths throughout the Congolese territory.
The epidemic now affects 20 out of 26 provinces, and nearly 25,000 suspected cases have been recorded. Over the weekend, Congolese authorities and the World Health Organization declared the outbreak a humanitarian emergency. The Ministry of Health, WHO, and other humanitarian partners have thus agreed on a plan of response. About $400,000 will be disbursed by the World Health Organization. The current economic crisis in the country makes the population even more vulnerable. Health authorities hope to raise about $15 million to stem the epidemic.
Les autorités sanitaires espèrent à terme lever 15 millions de dollars pour endiguer l'épidémie.
And now we're being joined over the phone by DRC's Health Minister, Dr. Oli Ilunga Kalenga. Thank you very much, Dr. Kalenga, for joining us this morning. The cholera news surely must be some disturbing situation, especially going by what we've learned from the WHO, and that's over the weekend. Please, could you tell us exactly the situation of the disease in the country?
Well, what you need to know first is that this is the first outbreak since 1974, and according to a study conducted by Harvard University in the early 2000s, it identified the lake regions of the Eastern Democratic Republic of Congo as areas prone to cholera outbreaks. During the year, there have been outbreaks that come and go, but this time we have sounded an alarm because we put in place an epidemiological surveillance, and there are models which follow cholera statistics, and we have exceeded, which is unusual, with alert level areas with over 1,000 cases per week.
Une surveillance épidémiologique. Il y a des modèles qui suivent les statistiques de choléra.
Well, that's why we are saying this is a humanitarian emergency.
On avait dépassé certaines zones d'alerte, des niveaux d'alerte avec plus de 1000 cas par semaine. Donc c'est la raison pour laquelle nous avons donc déclaré qu'il s'agissait d'une urgence humanitaire. Ouais.
Dr. Kalenga, what measures are you taking to counter this outbreak?
The most important element to counter this outbreak was first to trigger an alert and mobilize the whole world. We first tried to send instructions to all provincial health divisions to ensure that guidelines for cholera outbreaks and public awareness are followed.
Des cas de choléra et de sensibilisation des populations soient correctement suivis. Il y a des guidelines, mais il fallait donc les rappeler sous forme de directives que j'ai émises.
I have written and appealed to all governors so that they involved personally and assume full authority to follow these committees, and we are also sensitizing the population.
Pour suivre ces comités, doivent s'impliquer dans les comités de suivi.
In the fight against cholera, there's always a multisectoral dimension. So I asked the Minister of Planning, who is also the chairman of the multisectoral committee, in this fight against cholera, to convene a meeting of all the multisectoral committees so that we can coordinate our plans in the fight against the epidemic.
Pour qu'on puisse essayer donc de coordonner les actions de lutte contre le choléra.
At the department level, the most important element is that a new cholera elimination program is created with a national coordination and rapid intervention division with teams that are sent with medicine, but above all, also for management protocol to support teams deployed in the field.
des protocoles de prise en charge pour prêter main forte aux équipes qui sont déployées sur le terrain.
The WHO says that more than 500 people have died so far from this epidemic. Could you please give us some more information on the casualties and the regions affected?
Donc, depuis le début d'année,
since the beginning of the year, there has been 24,000 cases that have been reported throughout the country. Of these 24,000 cases, there are about 500 deaths, which is less than 2%, which is also within the norm of the usual care. Even if there are serious cases, the rate of equality is extremely low. What we got as statistics is that there were very red zones. The country has been divided into 3 zones. There are 2 red zones, which are the Bandundu near Kwilu and Otlomani. In Kwilu, we have already started, and the outbreak is totally controlled and is in clear regression. In Upper Lomani, there is still the need to intensify the campaign.
Là, on doit encore intensifier la campagne. Alors, les zones qui sont plutôt
the areas which are still in danger are the 2 Kivu regions in Goma, where I visited in July. There's already a sharp decline, and the situation is under control, but Bukavu remains our focus of attention. And we must continue to take measures, especially in terms of water, hygiene, and sanitation.
I'd like to thank you very much, Dr. Kalenga, for speaking with us this morning. And we will definitely be following up in monitoring the situation in the country. Dr. Oli Ilunga Kalenga speaking with us there from the DRC, Kinshasa.